Is an autologous fascia sling procedure right for you? Are you struggling with stress, urinary incontinence, and wondering if an autologous fascia sling procedure could be the right choice for you? This surgical treatment is designed for those who have not found relief from other sling surgeries or who prefer to avoid synthetic mesh implants. The procedure uses your own fascia, which is connective tissue, typically taken from your abdominal wall or thigh, to create a supportive sling under the urethra. This helps restore continence. The autologous fascia sling can be particularly effective for patients who have experienced recurrent stress urinary incontinence after previous surgeries. Studies indicate that cure rates for this procedure range from 50 to 78%, with many patients reporting significant improvements in their quality of life and symptom scores after surgery. When considering this procedure, there are several key factors to keep in mind. First, it is often recommended for individuals with recurrent stress urinary incontinence, especially after failed synthetic sling surgeries. It may also be suitable for those with intrinsic sphincter deficiency or urethral hypermobility. If you have concerns about synthetic materials due to safety issues, this procedure could be a valuable alternative. The benefits of the autologous fascia sling include long-term durability and a lower risk of complications associated with synthetic mesh, such as erosion or infection. Many patients find that using their own tissue leads to better outcomes in terms of continence. However, like any surgical procedure, there are risks involved. Potential complications can include bladder injury, which usually resolves with catheterization, and voiding difficulties that may require temporary catheter use. There can also be wound complications at the site where the fascia is harvested. A moderate overall complication rate of around 20% has been noted, and urinary retention is more common with this procedure compared to synthetic slings. Your individual health factors are also crucial in determining if this procedure is right for you. It may not be suitable for older patients or those with severe health conditions, as the surgery involves harvesting tissue and may require a longer recovery time. Recovery typically involves a hospital stay of about 2 days. Some patients may experience temporary urinary retention or issues with wound healing. Proper surgical technique and thorough patient counseling are essential to manage expectations and minimize risks. For those with bladder health concerns, especially if there is a history of pelvic radiation or mesh erosion, an autologous fascia sling may present a safer option. However, any surgical intervention should be evaluated carefully by a urologist or urogynecologist, particularly for individuals with a history of bladder cancer or ongoing bladder issues. In conclusion, the autologous fascia sling procedure can be a suitable option for managing stress urinary incontinence, especially for those who have not had success with previous synthetic sling surgeries or prefer to avoid mesh. It is important to weigh the benefits and risks carefully and to consult with a healthcare professional who specializes in bladder health and urinary incontinence. A comprehensive evaluation will help determine if this procedure aligns with your specific medical needs and treatment goals.